Hello, my name is Pereira and I will be talking briefly about some preclinical endpoints and how they can help in our efforts for drug discovery and translatability in pain. Most nociceptive tests rely on parameters such as the latency of avoidance behavior, stimulus intensity necessary to induce an avoidance behavior, or the observation and quantification of specific nocifensive responses. However, these symptoms are not always clinically relevant since they are not evaluating the same symptoms that patients complain of, and this can lead to translation failures in clinical trials. Therefore, the assessment of non-reflex indexes of pain in animals may be critical for translational research. The various components of pain can be dissociated. It is possible to suppress the affective aspects of chronic pain without impacting reflex responses, and vice versa. In mice with lesions in the anterior cingulate cortex, it is still observable neuropathic mechanical hypersensitivity. However, the aversive aspect of spontaneous pain and the anxiodepressive components are abolished. On the other hand, when there are lesions in the posterior insular cortex of mice, the neuropathic mechanical hypersensitivity is abolished, but the anxiodepressive component is still present. There's a similar dissociation that might be possible when testing drugs for their pain-relieving action. And so we think that combining nociceptive tests in models of pain to more multifaceted animal measures of pain that will encompass the autonomic responses, sleep dysregulation, cognitive deficits of the animals will help improve on the development of molecules that have a better translatability into the clinics. To improve this translational success, we propose to evaluate more complex pain states that involve not only the nociceptive endpoints, but also non-evoked or spontaneous endpoints, emotional and affective comorbid endpoints, and also immunological and molecular biomarkers. I'll show you some examples of what these tests can be. For example, in non-evoked or spontaneous pain endpoints, we can evaluate locomotion and gait tests to inform on animals' pain. These can involve tests such as the weight-bearing, the laboras, the catwalk, or the rotarod. We have used the weight-bearing test in models of inflammatory pain, such as the CFA model, to show efficacy of anti-inflammatory compounds in reversing weight-bearing deficits. We have also used this test to distinguish between the early inflammatory phase of the monosodium iodoacetate model of inflammatory pain and the late phase of this model, which presents more neuropathic characteristics. We can also test for non-evoked or spontaneous pain by using tests of active avoidance or of place conditioning that allow to integrate the aversive component of the pain into the test. We can use a conditional place preference or conditional place avoidance test for this. We can also assess the emotional and affective comorbidities that chronic pain brings to the animals. In this category, evolutionarily conserved behaviors and alterations of such behaviors can reflect the effect of chronic pain on motivation and general well-being in measures such as sleep disturbance, burrowing, nest building, or grooming. We can assess sleep disturbances using EEG sleep-wake patterns. In a model of chemotherapy-induced neuropathic pain, we observed disruption of the sleep-wake cycle with an increase in the amount of sleep time during the dark phase, the active phase of the animals. And treating the animals with pregabalin was able to reverse the effects of chemotherapy in the sleep pattern. We have also looked into burrowing behavior in a model of traumatic neuropathic pain. and we have observed a reduction in this behavior in the affected animals, which was reversed by pregabalin treatment. And although this data is not shown here, we have seen similar results in a model of diabetic neuropathic pain. Anxiodepressive consequences, which often accompany chronic pain, can also be evaluated by assessing anxiety and depressive-like behaviors. By using tests such as the open field and elevated plus maze for anxiety-like behaviors, and forced swimming and sucrose preference tests for assessing depressive-like behaviors, several studies have shown promising effects on the use of such tests to assess effective comorbidities of pain for drug discoveries. Chronic pain can also translate into molecular alterations in cytokine, chemokine, and neurotransmitter profiles. Identifying these alterations will help predict pharmacological efficacy and track disease progression, which will be helpful in drug discovery. We have used multiplex analysis of inflammatory cytokines in clinical and in rodent samples, and we have observed that in the monoiodine acetate model of inflammatory pain, there is a specific pattern of alterations in the inflammatory profile of animals, and that the stages of the disease can be linked to alterations in specific cytokines at specific time points. Similarly, we have identified potential plasma markers for neuropathic pain progression in a model of traumatic neuropathic pain. We also identified alterations in the inflammatory profile that are specifically related to particular treatments, pointing to good biomarkers for treatment efficacy. We can conclude then that various indirect measures of pain can now be key in important research efforts, and that combining nociceptive tests with more multifaceted animal measures of pain might be beneficial to drug development. If you would like to hear more or discuss this subject further, please contact me or any of my colleagues at Transpharmation. Thank you for listening.